One of the problems that I have with traditional therapy, and I'm a traditional therapist by training, is that we are taught to think about what's wrong with the person. We're taught to find the symptoms and the problems and make a diagnosis and put a label on a person. And so we're constantly thinking about what's wrong with the person. Well, that doesn't necessarily help us understand what we have to do to help the person get better. We're not fixing their problem, we're not treating their diagnosis, we're treating the person, and we're trying to help the person feel better. In this course, I'm going to teach you one important thing, and if you do this one thing and one thing only, it will drastically change the way that you start thinking about your clients and what you're doing. Instead of thinking about what's wrong with the person, I want you to start thinking about what happened to the person. Most of our clients didn't start out with these problems. In fact, most of our clients were healthy and happy from the get-go until something happened. Maybe it was one thing, maybe it was a lot of things. When something happened or some things happened, it dramatically affected the way they think, the way they feel, and the way they behave. As they have gone throughout their life, they adapted, sometimes adaptively, positively, sometimes maladaptively, to deal with their emotional pain and to cope with whatever situation they might have been in. That's what produces what we call symptoms. Emotional symptoms, behavioral symptoms, distorted thinking. All of those things started usually in early childhood, usually before the age of 10. Sometimes it was later, but most of the time it was before the age of 10. That's when they formed their behaviors, and that's when they formed their beliefs. We're going to learn about how to access those deep core beliefs and modify their adaptive and maladaptive behaviors. It is important to understand that all behavior was adaptive originally. It helped them to cope and deal with whatever the situation was that was occurring at the time. Over time, what was adaptive became maladaptive. So if I'm 30 years old today, still thinking like a 7-year-old and still behaving like a 7-year-old, as many of our clients do, then those old methods don't work anymore. Those old strategies don't work anymore. So we have to identify those strategies. We have to identify and find what is producing the symptom, and then restructure and change those symptoms and that thinking and that behavior in order to create a new strategy and an updated version that is healthier and more adaptive.